Okay, we're going to get started shortly. They were quiet looking for people looking here. You're here. Yep. Good morning, everybody. Today is Tuesday, March 24th, 2026, and this is a regular meeting of the Board of Supervisors. Madam Clerk, please call the roll.
Joe Neves.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Rusty Robinson.
Here.
Robert Thayer.
Here.
We're wondering why yours is so loud. That's why I'm making the face.
Oh, I don't know. How do we turn this thing down a little bit? Testing, 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 testing. Let's get it.
Okay.
Thanks, Doug. Thank you. I went to the Rotary dinner, Doug. All right. Pastor Devlin, I think, is going to start us off this morning. Pastor?
Well, frame this with I had a whole 2 minutes to prepare.
Yeah.
They're done. Please your eyes. You know, it says wherever two or more are gathered in his name, that God will be there. Well, there's quite a few of us in this room, so be assured that God is here. And we have some pretty weighty issues to look at today with the passage of certain legislation. It's going to change some things. So we do need some wisdom, and the ultimate wisdom comes from God. So do not rely on what we know, but lean into God's wisdom. Amen.
We begin. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll move on to item 2, unscheduled appearances. This is an opportunity for members of the public to address the board on items of interest within the board's jurisdiction and which are not already on the agenda. The board will not answer questions impromptu, or concerns or complaints will be referred to appropriate staff. For items which are on the agenda, members of the public will be provided with an opportunity to address the board as each item is brought up for discussion. Speakers should limit their comments to no more than 2 minutes. Madam Clerk, is there anyone online?
I have no written correspondence and no one online. The first speaker card I have is Matthew Boyette.
Morning, Matthew.
Wasn't sure if I was first or not, but thank you very much. Good morning, Mr. Chairman, members of the board. Matthew Boyette, Assistant CEO, Kings County Administration. Just want to formally and publicly announce a new addition to the family here. We just recently hired our Deputy CEO, which is Unchung Perry. No stranger to the county, as a familiar face to a lot of us in this room. Previously serving as the Deputy Director of Behavioral Health, and then recently was over at the City of Visalia for a little bit. So glad to have her back home here in administration to help us do all the great things we've got going on. So just wanted to introduce her again, a familiar face, and welcome her. And we're super excited to have her on board. So she says she has a big speech prepared. That's why she brought her book, because she's got so many pages written down, but you want to take it away, Antron?
Good morning, Chairman and Board of Supervisors. First, I would like to thank Kyria for giving me this opportunity. I look forward to working with Kyria and the administration team. Thank you.
Thank you, Unchung. Welcome back.
Thank you.
Anyone else? Okay, very good. Anybody in the audience that would like to speak? Okay, then we'll move along to item 3, approval of the minutes. Report out a closed session from the regular meeting on March 17, 2026. Madam Council?
There's nothing to report.
Nothing to report. Okay, item B, approval of the minutes from the regular meeting for March 17, 2026. I'll entertain a motion.
Second.
Supervisor Thayer and then Supervisor Verboon. Madam Clerk?
Joe Nevs,
Yes.
Richard Valley.
All right.
Doug Verboon.
Yes.
Rusty Robinson.
Yes.
Robert Thayer.
Yes. Item four is the consent calendar. All items listed under the consent calendar are considered routine and will be enacted by one motion. If a board member has questions, requests additional information, or wishes to comment on the item, the vote should not be taken until after questions have been addressed or comments made, and the public has an opportunity to comment on the consent calendar items. Are there any questions, or does anything need to be pulled? Hearing none, are there any questions from the public? All right, I'll entertain a motion.
There's no question, comment on the approval.
Supervisor Verboen, Supervisor Thayer. Madam Clerk?
Joe Nevs,
Yes.
Richard Valley, Doug Verboon.
Yes.
Rusty Robinson.
Yes.
Robert Thayer.
Yes.
All right. Moving right along. So we'll go into study session, I believe, and that would be CEO.
Mr. Chairman, at this time, we actually would like, the study session is not scheduled till 10:30. We have some guests coming to present the certificates for CSAC. So we actually would like to request that if your board could proceed with board member announcements or reports, and then take up some closed session items, and then come back out at the appropriate time.
Right, let's go on. We have a problem with that. All right, we can go on to board member comments. Supervisor Net?
Thank you, Mr. Chair. Continuing now softball at Normal High on March 17th, attended the American Legion on the 17th as well. Kathy and I had the pleasure of judging the 4-H presentation day on the 18th, a variety of prepared speeches and demonstration projects. It was really nice turnout. On the 19th, attended the Calamigos Finance Committee where we finalized the 2026-27 operational budgets, and as we'll see on the study session later this morning, a lot of those budget assumptions were a little bit more difficult, especially when you're talking about enrollment changes and rising costs. Also, the Calamigos Regional Authority Board also had a meeting that day, and we reviewed the quality improvements and utilization management work plans, and all the reports were reviewed and approved. That's what Kings had its regular monthly meeting on the 19th. With updates from the Grower Committee, administrative consultant, and progress on the well registration. The well mitigation policy was reviewed and approved. On March 20th, attended the Adventist Health Match Day celebration at the hospital. That's a day when medical doctors are selected to finish their formal education at hospital site. The Adventist Health delivery system. Hospitals in Bakersfield, Tulare, Sonora, and Hanford have a fine group of physicians that will complete their education and become the class of 2029. On March 21st, traveled to Visalia for the debate in the 2026 blood clot walk. Blood clots are a gel-like clump that's in your bodies that are there naturally to stop bleeding, but they become dangerous when they start blocking blood flow. Medical treatment is also important and to avoid severe complications, and they had a pretty good turnout this only the second year. Donated blood for the 140th time, bringing my personal total to 17.5 gallons. Central California Blood Center. That makes about 49 years, but they're the first 10 I wasn't very active. We started bringing them back in Stratford. We were doing 1 or 2 a year, and then we got up to 4. And then I started going to the center, so it worked out better for me, so it worked out pretty good. And then yesterday, the Kings County Behavioral Health Advisory Board held their monthly meeting and the only action was the minutes and then a couple of informational items. The board retreat is set up for April 27th, and an update to the mental health service. With that, thank you, Mr. Chair.
Thanks, Supervisor Thayer.
Yeah, thank you, Mr. Chair. Wednesday, it's last Wednesday, I kind of talked to you, you were there. I wasn't there for this meeting, but they just kind of stumbled upon it and just with Frank Reese and champions and Nick Bear from the sheriff's office sits on that champions board, and Supervisor Robinson can get more on it, but another project potentially coming to this county, and we're looking for some land. That same day attended our monthly Kings ACO executive board meeting. Things are progressing all over there. A lot of confirming things that we learned last Monday when we were at KPAA, and about Saturday we learned that there was a base of approximately 60-year-olds that are finding themselves homeless because of rent and power and energy and everything else under, and, you know, kind of confirm that over a meeting with the PCAO. That's what I say, there's still assistance through that agency for assistance with power, housing, rent. I mean, I think, I don't remember that, I think it was in the $7 million range that they have to spend over the course of the next 3 or 4 years. But if you know anybody out in the communities, it's those who are gathered here online, you have outreach in your community, just know that there's some resources there. And Thursday, if you know Fred Overholt, he was a long time resident, lived in the city, Camford. He grew up with my father-in-law, the Beacon Oil. Back in the Beacon Oil, the 3rd Street, right Avenue, and there were fire flames sticking out the top of that place. So back when it was still refining fuel in the state of California, we had one right here in Camford. And but anyway, Fred was a good human being. His daughter Candy Cruz, Scott Cruz, named Joe Cruz, the captain from Camford PD back in the day. So that's surrounding that family. Then just beautiful service for him. And then also Thursday, had privilege to have lunch with our new sheriff, Dave Putnam, and that caught us on a long time colleague of mine that for many years. He was just, got caught up with what's going on with the sheriff's office and just throughout and then, as I mentioned, Thursday also attended the King's Commission on Aging. Not the board meeting, we have a new board member that represents the city of Lenore. I wish I could remember his name. I don't know, but I did not write it down. And that's all. Thank you.
Thanks, sir. Supervisors, we got. Thank you, Chairman. I'll just report out on the chairman meeting about the city on Thursday evening. Thank you, Chairman, for that comment. And listening and I think 2.5 hours there. On the value of the bill that and the turnout. Heard from a lot of residents of Academy that concerned. I think another thing that we was just I'm not sure that's something that we can. Structure of all the things that I've been sharing with them for the last couple of years, and some of these things take time, but the concerns are real, and then I do want to thank staff who helped, who deserve thank you for some of the staff in there as well. And everything from the flyer, the presentation to the logistics and a lot of them coming and stuff and stuff. I just think the city could shut up. Yeah, you did a great job too. Thanks.
Thank you. Wednesday, I had a sort of one more meeting in my segment. Thursday, we had a special board meeting for the 17,000 and that's over. We discussed my business plan and my audit. That's what we're going to keep. That's the plan. I think about that meeting. We have 5 over the show. So get that on it. That was confident. So the meeting is done. We travel. We try to do different things every time. So keep that going. That's the third time we've had it here. And then on Friday evening, we went to the Saturday River.
Thank you, Supervisor. We'll be back Tuesday with another shout out for youth and government day. Good job here, Christina Olivera and staff. And by good staff, and she did a wonderful job with it. Thanks again to Hampton Rotary, Sunset Rotary, and Mr. Walker's Memorial Rotary Club for making that happen. It was a lot of fun, and I'm ready for Chairman King to come back anytime and take a look. Last Wednesday, met with Frank Ruiz and Nate Ferrier, as we said, I think about it clear, for the champions recovery. They're looking for a place that's potential future location. Also, met with the gentleman seeking veterans assistance. So a shout out to Food Pennington for assisting him. She has a real kind heart and we should get it. Also on a Zoom call with Southern California Edison to discuss concerns, emphasize how high our energy rates are, and explain the need to broaden the definition of renewable to include major hydro and nuclear. I encourage more lobbying at state level and wildfire mitigation is number 2 on the funding page. 22. Thursday, I attended penalty about our pollution control district meeting. We extended some exemptions for residential liberating in 2030. I emphasized partnership with business and industry to make incremental changes. Also attended the East Farmers League luncheon to recognize President Supervisor Betty Mendez for his years of service. The Thursday late afternoon, Supervisor Valley and I, as we stated, attended the Kelvin City Community Forum regarding Senate Bill 1289. This is a question and answer session about the Kelvin City Hazardous Facility. Once again, good job to Supervisor Valley. Explaining the benefits of the facility in Kelvin City. Take all those in mind. Very valid concern. And we can bring our side as well. So they understand that the funding mechanism and the risk. Saturday, my wife and I attended the Sunset Rotary Great Takeout Dinner. Turnout was strong. Maybe sold out. Looked like it was. Good job to Bobby Wardson as the MC, particularly handling supervising them. Talking over there. And then yesterday, I attended the Cal ID grant meeting. We're in the process of updating some computers and deciding if the placement is necessary for others for live scans. Just long. Big deal for long. Every single building requires a live.
Thank you, Mr. Chairman. We are having some issues with our mics. This staff online hasn't been able to hear for like the past 5 minutes. So if you can just give us 1 second.
We'll take a short pause. Can you hear us out there? Testing, testing. Good. Okay. So we're back, and we have some hard times today, meaning that we have a meeting that is back here for part of this regular meeting at 10:30, but we're waiting for that gentleman to arrive. So what we're going to do right now is we're going to go into closed session, and then we're going to come back, and we're going to hand out some awards in a little while, and also have a presentation from Darren Mounts, the president of CSEC. Okay. So right now, at this time, we're going to go into closed session.
Mr. Chairman, actually, I've been advised by council that because we did not hear the last 5 minutes, the board members need to restate their comments.
Okay. Supervisor Nez.
No, we were able to hear Nev's and Thayer. It was you, Supervisor.
Okay. Isn't it public record on the YouTube video? We got it.
Was it working on the YouTube audio, Brian?
That's what they should do. Groundhog Days. Kevin said, everything went good. I've heard a lot from folks on, waste management. And all the constituents there that voice concerns are very legitimate. We heard them. Thanks to staff for helping. And staff.
Thank you, sir. Supervisor Ruben.
Chairman, I'm sorry. It's still issues with the mic. In fact, we don't want you to stay. No, it's all of them. It's really gloomy. It sounds like we're getting feedback. Justine, can you hear us? Justine, can
We can hear you on our mics. Right? Joy socializing. Can you hear us out there? Yep. You getting it? Testing, testing.
much better.
Check, check, check. Check.
Questions you come to Supervisor Allen?
No, as long as it is reflected in the minutes, we are okay. So we can proceed with my board announcement. As long as it's reflected in the minute.
Thank you.
I'm just doing it for me, but thank you. Thank you, Mr. Chairman. I apologize for the technology. Running for board correspondence. The board received the following reports from our finance department dated February 2026, the monthly Kings County Investment Pool Transaction Activity Report, the monthly fund balance report, the investment pool portfolio management summary, and the treasury report for cash investments. The board received correspondence dated March 9th from the Bakersfield National Cemetery Support Committee regarding an invitation to attend the 2026 Annual Memorial Day celebration. The board received various documents regarding the presentation to be a big vehicle bill on March 23rd from CSAC, a 2025-2032 projected impact of state and federal policy changes affecting California's public healthcare system, federal funding and policy changes, county health and human services advocacy principles and impacts, fact sheets regarding county indigent care, a fact sheet on HR1 county eligibility workforce, and HR1 impacts the county. Then frequently asked question about with 17,000 indigent health code. For upcoming events, the Kingstown Library will host its family game time at Stratford Branch Library tomorrow, Wednesday, March 25th at 2 p.m. Kings County Library will host its story time at the Hanford Branch this Thursday, March 26th at 10 a.m. Kings County Behavioral Health will host its Survivors of Suicide Law Support Group next Wednesday, April 1st from 5:30 to 7:30 at here on a Kings building on site. And for upcoming agenda items, the following agenda items are for April 7th, board meeting for 3:31 is canceled. Administration has 3 items in recognition of Sierra Pacific High School varsity girls basketball team. Appointment to Calviva and it claims for damages. Community Development has a renewal for Kings County Abandoned Vehicle Abatement Program service fee and a monthly report on planning commission action. District Attorney has an item on juvenile psychological evaluations. Finance miss item, we are establishing a debt policy that'll be on the 7th. The Health has 3 items: the California Home Visiting Program annual funding application, a First Amendment to Tribal Healthcare Alliance, and a resolution proclaiming April 6th through April 12th as National Public Health Week. HSA has 3 items in agreement with Reading and Beyond for Employment and Training Program Services, an annual update on Child Abuse Prevention Coordinating Council, and Child Abuse Prevention Month proclamation. Information Technology has 1 item on Master Service Agreement with Cherry Road, our payroll system for steady state application support. Our job training has 1 item on closeout of workforce investment opportunity sub-grant, and Public Works has an item on the Hickey diesel mower equipment purchase. And that concludes my report. Thank you, Mr. Chairman.
Thank you, Madam Council.
In your closed session, we have government section 54956.9, conflict with legal counsel, anticipated litigation, significant exposure to litigation pursuant to paragraph 2 of subdivision B of section 54956.9 of the document. Item number 2, government code section 54956.8, conflict with real property negotiators, property parcel 01906001000 and 01224006800. The agency negotiators for Martinez under negotiation, price in terms of payment. Item number 3, government code section 54956.9, subdivision B1, conference with legal counsel, existing litigation, Timothy Edwards versus County, case number 240399. Item number 4, government code section 54956.9, subdivision B1, conference with counsel, existing litigation, case number Salvador Segura versus County of Kings, case number 2001, SBU 0113. Lastly, government code section 54956.9, subdivision B1, conflict with legal counsel, existing litigation, Stephen Lance Mendez versus Corcoran Branch Library, case number 240205.
All right, thank you very much. So just to give you kind of an order of events and how we're going to do this, we're going to come back at 10:30 on closed session. We're going to do a study session, and we're also going to have a regular agenda item. Also later in the afternoon at 11 o'clock, we have California Public Finance Authority. We also have California Community Housing Agency meeting. And then at 1 o'clock, we have Mid-Kings River Groundwater Sustainability Agency special meeting. All right, so we'll see you in a bit. Thank you.
I've got red skin, and so when
Testing
I red
audio,
hair,
1, 2, 3.
it brings it out, and I look like a cockroach.
No, this makes you like challenge because it's all, that's my red there.
What's the opposite of the color wheel?
Oh, she's on the.
Yeah, it's a conversation starter.
Tomato. You would have been a little kid.
Yeah, I look like one of those. No, I was like, we're gonna do red, and my mom's like, that's not a good idea. I will do it. She's like, okay. And I had like a buzz cut.
Testing audio, 1, 2, 3.
So I know who I can ask. Hey, I missed something.
Thank you. Did you call it back?
Testing, 1, 2, 3.
Now it may not be an hour. Did you hear that?
Yeah.
It might be
so we
10.
might- Okay, so then we'll.
Testing mic 1. Testing mic 1.
The microphones are sounding a lot better. Thank you.
Testing mic 1. Testing mic 1. Test. Testing mic 2. Testing mic 2. Testing mic 3. Testing mic 3. Testing mic 4. Testing mic 4. Testing mic 5. Testing mic 5. Testing council. Testing council. Testing spare. Testing spare. Testing CAO. Test or CEO. CEO. Testing. Testing portable. Testing. Testing. Sibilance. Sibilance. All right, podium, podium. Still in the, there it is, other podium.
Testing microphones, 1, 2, 3. Testing mic 3. Testing mic 4. Testing mic 5.
Testing, 1, 2, 3.
Okay, welcome back, everybody. We just got back from closed session, so we'll have Madam Council update us.
Thank you. On motion by Supervisor Verboen, seconded by Supervisor Neves with the vote of 5-0, the Board of Supervisors approved a property settlement agreement between the county and Cornerstone.
Very good, thank you. At this time, we would love to welcome Graham Noss from CSAC, California State Association of Counties, and Paul Danchek. Thank you very much.
Good morning, Mr. Chair, members of the board. Delighted to be here. As you indicated, I'm Graham Knaus, CEO of the California State Association of Counties. So that means I have the great privilege of representing all 5 of you esteemed gentlemen on this board and the 291 other colleagues you have in the state of California. But today, this morning, right now, there's nothing more important than Kings County, California. And we had the pleasure of being in Tulare earlier this morning and hop along 198 to get over here. And one of the things that we do beyond our core of advocacy, which we'll talk about a little bit later, is run what is the national model for leadership and policy development for county employees. And we've been delighted for a number of years to have a satellite campus in the Valley. And actually, we've had multiple places in the Valley that has been held. And so today we have the great opportunity to recognize some of the folks that have done investing into their future so that they can better represent folks here in Kings. And so I want to hand it over to Mr. Paul Danchek, who runs our California Counties Foundation and is the brain behind our CSAC Institute.
Welcome, Paul. Nice to see you again.
Great to see you as well. Thank you, Mr. Canals. Mr. Chair, members of the board, CAO Martinez, I just want to thank you for your vision and leadership in designing an Institute campus to come here in the Valley itself. The Institute started way back in 2008 as a way to help those within county service to advance their leadership skills, recognizing that counties as a whole do really well on the management side of the house, but as folks continue to advance within their roles and responsibilities, there is a gap on the professional development side of the house. Last year, we partnered with Fresno, Kings, of course, Tulare, and Madera counties to be able to host a campus, to really see it as a way to have this regional approach in tackling some of the wicked challenges that we face. I come in celebration today. The easiest way to be able to explain why we come physically here is a quote that DeWitt Jones, who was a photographer at the National Geographic, once said. He said, "By celebrating what's right with the world, we're able to have the energy to fix what's wrong." And there's certainly a lot of challenges out there that we need to collectively face. And being able to pause and to be able to celebrate is a big piece of the work that we do. Going through the Institute itself is no easy feat. It's 50 hours of instruction over 10 courses. And we recognize that as folks are going through the program, they're not stopping their day job, they're continuing it, right? So thinking about those roles and responsibilities that they fulfill happen at different times, different hours, so they're able to dive into this space on being able to tackle this idea around leadership and what it means. We know that professional development works. We know that works in the short term. We know that works in the long term through various studies that the foundation undertakes to be able to recognize the immediate impact that it has on the individual to help with their career growth and trajectory. We also know that it has a direct feedback back to the organization to increase engagement and performance. And those are all great things. And with that, CAO Martinez, if we'd like to recognize the graduates, we have a credential and then a photo afterwards.
So we have 5 county staff that have gone through the cohort. Currently, right now, we have 10 for the current year. So we'll have a similar ceremony next year. And so I just want to take a moment to recognize the 5 that are here present today. So we have Michael Amin from administration.
Congratulations, Michael. Good job. Thank you. And Paul, thank you for bringing it near to us. When you bring it to Fresno like you did, it just makes it much more accessible for folks. Like you said, they're working. They're still working. So thank you.
We're happy to do it.
Next, we have Mitchell Cabrera from Public Works.
Congratulations, Mitchell. Thank you.
Yes, he is on his way right now, our PIO. There he is.
Sorry. I apologize.
Yes, if
Hey,
we can get
let's try this again, gentlemen. Now that we have our photographer, Mitchell, you want to come up, and Michael, you want also. We'll do it one at a time. Come into the well, so we'll take a picture. So we'll start with Michael.
Chairman, would you like to join the
Sure.
photo, please?
Yeah.
Graham, having the certificates a little later, it kind of threw us off a little bit. So-
Perfect. So 1, 2, 3. Fantastic. Thank you.
Okay, Mitchell, you're next up.
Mitchell Cabrera is our chief engineer in our public works department. Next, we have our assistant director for public health, Heather Campos. While she's coming up here, so every Friday they rented a van and they traveled to Fresno together. So there was also a lot of bonding time that occurred during that travel to Fresno. And then we have Leo Jimenez. He's our UC co-op director. He unfortunately could not attend this morning. But lastly, we have one of our own as well, Sarah Poots, our risk manager. You know, Sarah was let me know that during her driving sessions to Fresno, she got to learn a lot from all the other departments and what they do in their roles. So
Thank you.
with everyone, how about everyone?
Yeah. I mean, he can drive. Let's see, leave like a space in there, you know. Yeah, there you go. We'll try it out.
Oh my gosh.
I'm sure someone can figure it out. All right, 1, 2, 3. Oh, yeah. We'll figure something out.
And then if we can get everyone who received their certificates in the well, so one group photo.
Yeah.
Sure, why not?
Okay. Perfect. Okay, 1, 2. Thank you.
Gary, we got it. Get 30 minutes out of you.
Okay, we're just going to take a temporary pause for about 3 minutes. We'll be right back. The next meeting can't happen until at least 10:30. We're going to start up again. Madam CEO?
Yes, thank you, Mr. Chairman. Kyria Martinez, CEO, Kings County. Today we have a study session for your board and members of the public to talk about some changes in the passage of the House Resolution HR 1, known as the One Big Beautiful Bill. It was enacted in July of 2025. And so this legislation is expected to impact the county's budget, health and social services, and administrative operations, and will increase both operational demands and fiscal responsibilities. Today's presentation will provide a board an overview, and we have a few guest speakers online and in person who will speak a little bit more in depth, with Wendy, our HSA director, taking the lead on the most bulk of it. So at this time, I'd like to introduce Wendy Osikafa, our Health and Human Services Agency Director. Thank you.
Good morning, Chairman, members of the board. Wendy Osikafa. I can't even say my own name. Osikafa, Director of Human Services. As Carrie mentioned, HR 1 is federal reconciliation legislation that was signed into law July 4th, 2025. HR 1 included mandates for many things, but today we're going to be focusing on Medicaid and SNAP, also known as CalFresh and Medi-Cal, respectively, in California. Each of these two programs are operated under separate federal cabinet secretaries and so have different rules and operating structures. SNAP is overseen by the U.S. Department of Agriculture, Food and Nutrition Services, while Medicaid falls under the Centers for Medicare and Medicaid Services Division within Health and Human Services. Ultimately, these new provisions aim to reduce federal spending by limiting eligibility and access for individuals to each of these programs. However, it also enacts significant cost shifts from the federal to the local level and substantially increases the administrative burden and workload to operate both of these programs. Today, we're going to focus on each of them separately to try to bring clarity and minimize confusion, because the rules, the timelines, and the impacts for each are not aligned and do vary significantly. Next slide, please. I'm going to start with CalFresh. SNAP, also known as CalFresh, is a federal entitlement program. Individuals qualify based primarily on their low income. In Kings County, there are approximately 36,000 individuals that receive CalFresh benefits. About 30% of those are children. This represents approximately a quarter of our county's total population, so 1 in 4 people. Annually, over $65 million in benefits are issued to individuals in Kings County. HR 1 impacts this program in 3 major areas. First, the impact to the community or directly to the individual recipient. We're expecting that a little over 2,000 residents may be subject to expanded work requirements. There are individual exemptions, and there is an opportunity for a countywide waiver based on the county's unemployment rate. However, for this program, Kings County is not eligible for a hardship waiver, as the rules require that the unemployment rate be above 10%, and we are currently sitting a little over 9% in our county, at least the last time I checked. So we will not have a waiver for the expanded work requirements for CalFresh. There will be approximately 9,700 individuals that we anticipate will have a reduction or loss of benefits. About 5,000 we think won't be impacted and will be able to maintain their current benefit level. And then there's an estimate of a little over 600 individuals that are legal immigrants, but the rules have changed and they will now lose their eligibility. The workload impact to enact these changes is significant. So the expanded work requirements, the new asset limits, changes in the eligibility requirements, exclusions of populations previously eligible, all create additional administrative costs for us. We're going to have to do significant workforce trainings, updating of our statewide system will be required, and the increased workload related to the implementation of the work requirements. So that'll be something new that we have to verify as part of their application package. HR 1 did not provide funding for any of those workload increases. So the third area is cost increase to county. So there's a cost increase with the workload. That's one component, but what I'm going to talk about now is entirely separate from that. In addition to the workload costs, HR 1 shifts costs to the local level. There are impacts on both the administrative and assistance components of this program. First, I'm going to talk about the administration element. Think of that as my staff, the cost of doing business. So this covers my eligibility workforce, and our operations in the county. Effective October 1st, the federal share of administrative costs will be reduced from 50% to 25%. That reduction becomes an increase in cost to the state and counties. The best way I can explain or demonstrate this is if you look at the little table on the bottom right corner of that slide, that first column is our current share of costs. 50% federal, and I use easy numbers. I didn't want to get into a math conversation and have to do math on the spot. So $5 million would be the 50% federal contribution. The state share is 35%, so they would put in $3.5 million, and the county would put in $1.5 million to operate a $10 million program. The share of costs will change October 1. The feds will no longer provide 50%. They will only provide 25%. So now they will only put in $2.5 million. So to operate that same program that costs $10 million, the state's going to need to increase to 52.5% or a little over $5 million. And we will need to increase to 22.5% to $2.2 million. You can see the difference in that final column. It's just a straight cost shift that comes to the county for doing exactly what, the same. We're not expanding the program. We're not changing anything. It's just cost of doing business. The 10 million is not our exact budget, but it's not too far off. And so let me get back to my numbers here. The actual cost increase for fiscal year 26-27 is projected to be approximately $820,000 for us, which is on top of the $1.4 million that we're currently paying.
Hey, Wendy, just real quick.
Yes.
I just want to clarify a question. So on the left side, the third from the bottom bullet point, the 9,700 will have a reduction. So when you say that it's going to cost us X amount of dollars to provide the same services, is it including that reduction, or is it keeping the 9,700 and the 600 fall below it at the same levels that they are now?
Yes, that's a good question. And that's sort of that'll be the next little part I get into. So our administrative costs do not include payments to the recipients. This is just the cost of my worker that needs to sit down and meet with someone, interview them, get information, confirm facts, enter it into the system. We have to do that whether they're approved or denied. So those 9,700 people are going to come in. They may not be able to meet the requirements, but we will still meet with them. So our workload is still there. Now on the assistant side, that is current, and let me talk about that separately in 1 second, but that is currently 100% federally funded. We don't pay that money. We don't have a cost there. So if we're not paying 9,700 people benefits, it's not a cost savings to the county. It's a federal cost savings. Because that's not a cost that we incur. Our costs are about running or administering the program on the administrative side. Does that make sense? Does that answer kind of? And I'll get into a little bit.
I don't understand anything that reduction. I mean, we're still having to pay our employees to do
the work,
the same amount of work, but
yes,
it's less money.
That's right. Okay, so on the administrative side, that really is sort of the end of that component. It's just that our increases are expected to be about $820,000 to make up for what we'll lose from federal. So now, kind of speaking to what you were mentioning, Supervisor there is some down the road impacts on the assistant side. So that is really the money directly paid to individuals in our community. That goes straight from the federal government to them. We don't pay $1 of that. That's that $65 million that I talked about that goes out and gets paid directly to individuals. I'm getting ahead of myself. HR 1 includes a new benefit cost share for states that could start as early as 2028, but might be able to be laid to 2029 or 2030 under certain scenarios. The cost share is tied to each state's payment error rate. The share of cost penalty can be anywhere from 5 to 15%. So 5 to 15% of 65 million is not small change. The state's current error rate will likely place California in the 15% share of cost range. I think our error, is it up there? I think we're at like almost 11%. To be clear, there are no state provisions to pass these penalties to counties, these new penalties to counties, as of today. However, the prior practice of the state, and most recently, we've seen this in their efforts related to IHSS, include the pass-through of the CIFCO penalties. So these are penalties that the feds give the state, and the state used to pay them. And now they pass legislation, and now those penalties come straight through the county, and the state doesn't share in those penalties. So if we just look at past practice, I think this is something we're going to need to watch and monitor, because it is likely that there will be a pass-through. So we need to monitor for the risk of this changing in the future. Further, the errors that determine the penalties are tied to our workforce. Errors can be mistakes that staff make, but they can also be made by the recipients. They can be system errors at the state level, and they can be as simple as the application being completed a day late. Fortunately, this provision is something we have a few years to prepare for, and I'm really only mentioning it today to raise the awareness that this could be coming our way. And there will be a need for advocacy should we start to see the state starting to move in that direction. Also, decisions that we make this year will have impacts. If we decide to reduce staffing to compensate for this increased cost, we will increase our errors, we will decrease our timeliness, we will create backlogs, and that will then increase our error rate, subjecting us to higher risks. So there is a connection between the administrative work that will have an impact on the assistant side of penalties. I want to check in with you. That's where I was going to sort of end it with the CalFresh piece and see if there's questions here. And then I was going to move into the Medicaid.
Very good. Do we have any questions?
Just
Board?
one, just one.
Yes, sir.
Sorry. If anybody else wanted to, so I just have one. I don't know if you even have an answer, but I know that you said 10% for unemployment rate. Is there even any California counties that have a 10%? I mean, we're pretty poor and have a high.
There's a
Is there, Graham?
There's a few that will qualify under this. I feel like they're some of the northern counties. I don't know if you know them off the top of your head.
Okay, thank you.
Yeah, so we will not qualify under CalFresh, but when I start talking about Medicaid, the circumstances change.
Other questions for Wendy? Anybody? Do we have any questions from the audience? Any comments? We'll move on.
Okay, so next slide. So for Medicaid, in Kings County, we have approximately 69,000 individuals enrolled in this program, which is 45% of the county's total population. HR 1 also impacts us in three major areas. First, impact to the community or individuals that are recipients. We're estimating of that 69,000, which a huge portion of which are children, approximately 19,500 will be subject to the new work requirements and more frequent eligibility verifications. Other changes that will be individuals much like CalFresh that are lawfully present immigrants that will no longer be eligible for coverage beginning in October of this year. The workload impact tied to this, it is the workload impact of the work requirements is a new requirement, and they are different than the requirements of CalFresh. This adds to the training and system updating and workload that I already mentioned, and it certainly adds to the confusion. Assessing for individual exemptions to the work requirement, for example, there are a number of exemptions. Persons with disabilities, parents that have children under 13. In CalFresh, the rules are parents with children under 14, and most of our families are receiving both services. Navigating these different rules for the same family will add to the confusion and processing time. The redeterminations for eligibility increase from 1 time to 2 times a year, so that's doubling our workload. There is some good news in this program. Unlike in CalFresh, Kings County does qualify for the unemployment rate waiver for this program, as the rules require us to be above 8%. And so for now, as long as our unemployment rate's above 8%, we will have essentially a countywide, it's called a short-term hardship waiver. And so we're still waiting on federal and state direction on exactly how that'll be enacted, but that should certainly help people maintain eligibility and provide some cushion on our workload as long as that waiver is in place. However, we do have to be prepared that should our unemployment rate improve, to that waiver could go away, and we need to be in a position to be able to meet the requirements of that. Cost increase to the county. There's the unfunded increase in the eligibility workload. We're really estimating that we have a need of about $1 million additional dollars to cover that increased workload. The state and counties are at risk of financial penalties. These aren't largely being talked about because they're really not slated to begin in 2029, and we've been most focused on the CalFresh penalties. But they did expand the types of payment errors and penalties, and it added some restricting of waivers, and so there's some risk there in the out years as well. Most concerning and imminent is that counties will likely face higher costs for behavioral health and health services. Then this impacts not only my department, but the behavioral health department, the public health department, our federally qualified health centers, rural clinics, and medical providers in our county. As individuals fall off Medi-Cal coverage, it will reduce their revenue available to operate. Additionally, there are reductions to the public health care systems through new limits to state-directed payments, as well as reductions to federal match for certain adults seeking emergency care. All of these result in revenue potentially increase our costs due to indigent care. And so WIC 17000 establishes the legal obligation for counties to provide basic medically necessary care to medically indigent lawful residents. It is estimated that approximately 70% of individuals will not be able to meet the new work requirements and will therefore lose eligibility. While the employment waiver will help us with a large number of individuals, it won't fully solve the problem, and it again is dependent on the unemployment rates not changing. So the cost will likely increase in future years, and we will know as we no longer qualify for the waiver. Next slide. In California, there are 3 separate approaches to attending to the indigent care mandate. County Medical Services Program is one of them. We are one of the 35 CMSP counties. Today, we have Carrie Brownstein online with us, who'll be providing a brief overview of CMSP and the projected impacts to counties. Carrie, are you there?
I am. Can you hear me?
Yes.
Great. Hello. Thank you for having me. I am the Executive Director, Carrie Brownstein of CMSP. We are the Indigent Care Program for your county. So what happened in the 80s is the County Medical Services Program was formed after what happened back then is Medi-Cal law, Medi-Cal eligibility for medically indigent adults became the county responsibility under what we already heard about, Section 17,000. So we provide healthcare to those 21 to 64 in 35 counties. There's 39 counties that can be part of CMSP, but 35 have been with us for some time now. We do provide the health coverage for the uninsured low-income adults for people that are not qualifying for Medi-Cal. So people that fall off because of those work requirements are going to come over to CMSP, or for other reasons, if they fall off Medi-Cal, they're probably going to be coming over to CMSP. What's important to know is that CMSP doesn't have any ongoing revenue. So what happened with the ACA after 2014, most of our population moved over to Medi-Cal, but now some of those folks are going to be moving back over to CMSP. You do meet the unemployment right now, the unemployment rate to have that exemption. We feel like that's going to happen, but I know, Wendy, you might talk about it too. There hasn't been federal guidance, and we don't want to rely on that. So folks from your county could fall off Medi-Cal and onto CMSP, and we have no ongoing revenue. I think Graham's going to be talking later about the advocacy we've been doing at the state to talk about what we need in the future if people come on to CMSP from Medi-Cal. So we are governed by a governing board. Larry Spikes, your old CAO, was on our board from 2011 to 2017. We have 10 county officials, 3 SUPs, 3 CAOs, 2 welfare directors, and 2 health directors on our board. Also from your county, Sanjay Bouquet was on our board from 2018 to 2021. So the governing board sets program eligibility requirements, determines the scope of benefits, and sets the provider reimbursement rates for all of the everybody in our 35 counties. Our governing board meets tomorrow, and because of what's happening, is going to be talking about our current eligibility and our benefits and some changes that we're going to probably need to make in 2027 so we can fit within our budget, given that we don't have ongoing revenue. I'd like to stop there. I could talk for a long time about CMSP, and we can probably do that at a future meeting. But if there's any questions for me right now, I can answer them or answer them later on in the presentation.
Questions for Carrie? Any questions from the audience?
Thank you, Carrie. And Carrie's right. These are estimates. These are us projecting what's going to happen. We are still waiting for federal guidance that was supposed to be issued much earlier than this past year. And we certainly are waiting for state guidance on some of these things. So it's our best knowledge to date. We'll also be learning a lot in the coming months.
Just one more quick question. So I know SNAP and Medicaid, Medi-Cal are 2 different, right? And 2 different packages, let's just say, for programs. Thanks. But I just want to make sure. So if you go, for example, on SNAP, 2,000 plus residents may have the work requirement. Is that same 2,000 included in 19,500 that would be on the Medicaid?
There's a lot of overlap.
So there's because I guess at the end of the day, like, I don't know, maybe there's a spreadsheet into this that would give the actual, that would show these numbers here, and then obviously totals at the end, because I guess the next question is the additional cost of the county regarding SNAP, is that wrapped up in the additional cost of Medicaid, or is it that plus Medicaid?
It is, yeah, yes and no.
Yes and no.
So our same workers are funded through multiple sources. And so Medicaid and CalFresh are the 2 primary things. And you can imagine a family comes in and they're in need, and we're assessing them for all the programs that they might qualify for. What will continue to be a workload issue for us, even if there is a waiver on the Medi-Cal side, is that same person won't qualify on the CalFresh side. So they're going to have to meet the work requirements to get food stamps, but not to maintain their health insurance. And there are a lot of that's kind of the biggest one, but there are a lot of inconsistencies there. Someone might qualify for a waiver because their kid is 14 years old under, I'm going to switch them in my head right now, under CalFresh, but they won't qualify under Medi-Cal because their child's 14 and the rule's 13. So sifting through all of the rules and working that through with families is going to be complicated, and the work won't go away. So we have the waiver on unemployment, the work requirement on potentially for one side, but I still have to do it for the other, and most of those families are the same. The downstream impacts will be different though, right? So if we do qualify for the waiver, the number of people dropping off Medi-Cal will be less. So that should reduce our indigent care costs. If 70% of that 19,000 falls off and we don't have the waiver, then our indigent care costs are going to rise much higher. And so for counties that meet the waiver, it gives us a little bit of breathing room to kind of ramp up, prepare for this, figure out the impacts, see what's happening in some other counties. And those Article 13, if you're talking to your peers and some of our neighbors, Article 13 and provider counties, they're in a way worse spot than CMSP counties. And while we need funding for CMSP, their panic is today, like right now. We run out of money with CMSP pretty quickly, but we've got a little, because we don't have ongoing funding, but we've got just a little bit of room to maneuver. So that's helpful. The next slide, I'm just going to I think we've already kind of done it, but the next slide was just to sort of wrap this up and transition to Kyria. It is a nice graphic. It really kind of brings these two programs together. On the one side, you've got fewer people covered. You've got hospitals losing funding. So there's more uncompensated care. This increases our indigent care, and that goes straight down to a county level impact. And then on the other side, what is concurrently happening is the federal cost share shift gets passed to the state, passed down to the counties, and that's something that we're going to have to shoulder as well. And so I'm going to let Kyria really talk about the broader countywide impacts.
So the three things that really strain the county budget is obviously the indigent healthcare, the public hospital systems, and the county eligibility workforce. I want to take a quick moment to bring Christy, interim behavioral health director, and Rosemary Ron, a public health director, just so they can speak on their impacts to their budgets, and then I'll talk about the county general fund.
Welcome, Christy.
Hi, good morning, Chairman, Board of Supervisors. Christy Lepke, the Interim Director, Behavioral Health Director at Kings County Behavioral Health. The HR1 impacts that we've assessed in behavioral health, and it continues to be evolving. We just received our state association letter regarding the governor's budget, which includes HR1 impacts. So the numbers that I give are just estimates and projections, but we estimate that we will see an impact come October 2026 when it comes down to the immigration unsatisfactory limitations that are coming out for Medicaid. It will be up to about 400,000 that we may see as an impact to loss revenue. So as it relates to the impacts, the financial impacts that we'll see, it's the impacts of still serving those with mental health needs or substance use disorder needs, but not having then an insurance to bill and get compensated for the services that we provide. So still needing to do the work, but not having a revenue source then to be reimbursed. So we anticipate about 400,000 in lost revenue for those with the immigration status restrictions. And then when the rollouts for work requirements and re-eligibility determinations start January 2027, most of those that we serve will fall under the work restriction exemptions because the state has said that those enrolled in specialty mental health services and drug Medi-Cal services by county behavioral health will be exempt from work restriction. But we also know that we will have a countywide exemption, at least at this point, because of going over the 8% unemployment rate. So we have a lot of insulation there. We feel that it could also then increase our engagement in services as individuals more likely engage in services to be able to have that restriction if needed. However, those who need to go through re-enrollment, all of our clients will have to go through the re-enrollment process. And those that we serve are suffering from severe and persistent mental illness, serious emotional disturbance, or addiction. And so they're already dealing with life impairments, major life impairments. And so the ability for them to engage in the redetermination process every 6 months can be quite taxing. We're going to do our best to be able to support them through those redeterminations so that they can keep their coverage. But we anticipate just a natural disenrollment due to the taxing process that they'll have to go through. And it's been estimated about 15% disenrollment. And that 15% would equate to potentially about $2 million in lost reimbursement, meaning we'll still need to serve individuals, but we just won't have an ability to get reimbursed by Medi-Cal for those services. And so that estimates about $2 million. And so we're looking at about 3 to 5% budget impact. We have a budget of about 64 million, so that would be between 2 to 4 million in revenue lost for us. So it hasn't posed to be such a significant impact, but it's only because we are able to continue doing services for those who are covered under the work restriction requirement exemption. So in any case, we don't feel it'll be as taxing, but I will say though that there are other indirect impacts occurring. So for instance, many of those that we serve are also CalFresh recipients. And so in the midst of having to do all of this additional work in redeterminations, they'll also be potentially losing their food security. And so we're really going to be looking at like, how do we help them through this so that we can keep their focus on the treatment that they need and not on their basic needs of where am I going to eat today? How am I going to feed, those in my family and my household? So there's a lot of indirect, and as individuals start to lose their CalFresh, they may start to make, and their health insurance, they may start to make other adjustments in their life that may then ultimately lead to a pathway to our doors. And so it could also increase those requiring services because of the stress of the economic pressures and the loss of now safety net services. So there's a lot of indirect impacts that we can't necessarily quantify right now, but wanted to make you aware of that.
You're thinking 2 to 4 at this point in your department.
2 to 4%.
Yep. Do we have any questions for Christy? Any questions or comments from the audience? Thank you, Christy.
Thank you.
All right, Rosemary?
Rosemary Rand, Department of Public Health. I feel like I need a crystal ball because there's some unknowns here. However, in 2014, before Affordable Care Act, as some of you who've been here a while will remember, we didn't have the clinic infrastructure we have now in our county. We now have federally qualified health centers all over our county, when before the health department did women's health clinics, well child clinics, a lot of clinics that were then gotten rid of because we didn't need that any longer. That said, the impacts of this will impact these federally qualified health centers if they're not getting reimbursed as well as the hospitals. So looking at the numbers, I mean, we're fortunate that we have CMSP because I think that's a little bit more of a safer structure than some of the others. However, I'm looking at a realignment. We do have some in reserve. Some of it's going towards our new building, and I'll have to project out those costs, which I anticipate is pretty close to Christie's estimates to about 2%, but how much we'll have and when we'll be out of that dollar amount. Every year we get about 6 million in realignment. If that stays level, it just, whatever amount has to go to indigent care is going to reduce how much is going in the health department. So we're going to have to reduce to just essential services if it's needed. So that's something to consider. Also, I know the federally qualified health centers and the hospitals are very concerned. Prior to ACA, people were going to the emergency room rather than the clinic, but now you're going to have a clinic structure. So I think it's a lot of education, and I'm not sure if people are going to feel safe to go if they don't have services, but I don't know. I don't know what I don't know, but I do know that the health department prior to 2014 was doing a lot of those primary services.
Years ago, when my dad was on the Adventist board, I think Ron Rosson was there. He was the CEO. But I think he's the one that kind of went to this clinic model. And the reason was to take the burden off the ER.
Right.
The problem is now we have all of these clinics and now they're going to withdraw funding. Is that accurate?
Well, that's my assessment and would be my guess based on what we're seeing with the numbers. Is there enough reimbursement to keep those clinics all open?
Do you have any questions for Rosemary? Anybody? Supervisor Nick.
More of a comment. I think I think what we do see in the population is that when they can't get into the clinics and they can't get into the primary care, they go to the emergency room because they might be covered under some kind of policy, healthcare policy. But if they call up on Monday and they don't feel good and they can't get an appointment till Friday, they're going to present themselves to the emergency room at a higher cost. Yeah. So even if there is a loss of clinics, there's already a demand being built up just simply because the clinics cannot see people on a timely fashion. And I think we're very fortunate in Kings County for even our own staff having the health clinic on site, because that pretty much allows you to be able to be seen the same day you feel lucky. And you're able to get that service that you want. Unfortunately, those folks that have other kinds of insurance don't have that luxury. And it's going to be a problem because I think you're seeing more and more of our emergency room demand increase. Fresno has already seen it. They had some of the highest emergency room presentations. Was that February or March?
I think it was in March.
Yeah, so, it's already, you're already seeing that influx of people.
And as you know, we've reduced the amount of hospitals.
Right.
Like, Madera lost their hospital. And so then you start seeing more influx into these tertiary care centers in Fresno and Visalia. So I just think, it's already a tenuous system anyway. So the impacts could be felt after this.
Any other questions for us? Yes.
Question, I don't know that you have the
Yeah.
right answer. Maybe
Oh.
it is, I don't know, but so it's like the state, saying, hey, stand by, we're gonna step up and do the next correct thing, or are they just kind of standing with folded arms like?
Well, that's a good
nothing
segue.
left?
That's a good segue.
That's a good segue to the next conversation.
My pleasure. I'll be here all day.
Thank you.
All right, before we get on to grit, thank you, Rosemary.
you.
But before we get on, are there any other questions for Rose? Yes, sir.
Not a question, it's a comment.
Please.
Brett Woolman, Deputy Director of Behavioral Health. Circling back on the hospital, we also have psychiatric emergencies, and they end up in the emergency rooms. They have the 72-hour holds. Part of what we have too when we talk about Medi-Cal billing, the other side of that is our realignment funds, where Medi-Cal billing protects some of that. That's part of what we've been looking at as well. So if this does impact, we also have the hospitals that get impacted with our clients. If we have limited clinic access because of the cost, then we get more spikes in crisis, and then it comes back to impact the emergency room, which we're trying to avoid that as well. So just to throw that back out for behavioral health as well.
And I guess a comment on that too, sorry.
Yeah,
Is that these structures, they don't happen overnight. If they disappeared in, fast forward 6 years and we do not have them, and we're like, okay, King's X, bad mistake, we need to build them again. You're talking decades to remanufacture, good set of terms.
And that's where our
Especially that
system of
setting.
care has taken almost 10 years to get where it's at now, to prevent this from leaching into other areas as well. And that really relies on the billing we can bring back in to sustain that.
And just follow up on that, the public has not embraced the telemedicine, telepsychiatry as much as I really had hoped for. I would have thought during the COVID era, people would have learned to do more Zoom meetings, and I think that improved everybody's intellectual basis to be able to do that. But unfortunately, we're having a real hard time with the public in utilizing those resources that you can through a telemedicine, telepsychiatry system. I was really hoping we'd be up above 10% in the 15% range, and we can't even get out of 2 or 3%. So again, as part of that's education, and there is some lack of trust because you're not seeing a medical professional across from you, and I understand that, but at least you'll be able to be seen in a quicker time with some kind of telepsychiatry or telemedicine. Okay.
And I have some, I'm not sure if you can answer this or Rose needs to, I'm not sure, but the way they measure the hospital, the strength of the hospitals, it's the number of days they can last without funding. And I think children's is like 5 years or something incredible. They're off the charts. How's Adventist doing?
I don't know their actual length of stay numbers, but traditionally, you're looking at a mix of Medicare, Medi-Cal, private insurance, and then obviously the faster somebody comes in, gets out, that's how you save money. Readmissions then cost more money. I don't know what their average length of stay is, but I will say it's usually longer than most hospitals want, just because of placements. But I don't know their numbers, but I can probably find out or have them come and share.
Any other questions, gentlemen? All right. Do we have any questions or comments from the audience? Madam CEO?
Yes, so the larger question is what everyone's listening probably on my department heads online and in person is what is that impact to the general fund? Well, if you go to the next slide, so annually when we present the budget, to your board, we always like to show our little pie chart here, which really tries to show what is discretionary, non-discretionary. So obviously we're heavily funded by state and federal, so that's your blue, and then you have your green, which is your discretionary fund, which ultimately funds your general fund department, sheriff, probation, DA, district attorney, finance, human resources. Well, what's essentially is going to happen is there's going to be an increased contribution to Human Services Agency. So for next year, the impact is going to be approximately 800,000 that Wendy had talked about. That is that is going to be absorbed. However, the request now from HSA, general fund contribution is now at 4 million. And just to give you context, in 2021, that was 2 million, 2.8 million. Now you're looking at a $4 million request in this year. So the board is going to have some decision points to make. As you know, general fund is going to have to reduce. You're going to have to reduce on your green side to give more to the blue side. So it is a point of discussion with the department heads and the board to understand just the impacts that your general fund is going to be facing. Like I said, Wendy's been gracious enough to cover 800,000 for the next fiscal year, but that's still increasing the contribution to Human Services Agency. The following years when it's going to really be that hit. You're estimated at $1 million to hit and to be picked up by the general fund. Just to give you context of what that means to the county general fund. Mm-hmm.
Wendy.
Yeah, I wanted to add, I mean, we have some prior year money that I think will help us float that kind of increased cost this year, absorb it a little bit better. But this is not, and I mean, this will be a bigger conversation when we come in for budget hearings, but this is not the only program that has increased costs. And the truth is, realignment revenue is not paying the bills. It was designed to pay the bills, but we're owed caseload growth 2 years in a row that we've yet to receive. We've got IHSS going up at a 4% clip every year. We've got adoptions, which is 100% realigned between 91 and 2011. So the state has no share of that cost. That's going up 10% annually, and it's another entitlement. So these are entitlement programs that I can't decide, like, no, you get some, but you don't. Like, if they qualify, they get the benefit, and the county in statute has obligations to pay our share, and every program's got a different percentage share of cost. But a lot of the programs in my department are a lot of these bigger programs are heavily reliant on realignment, and that's the only thing I can use. Like when that's gone, the only other place I can come is county general fund, unfortunately. And so I've been trying to offset the impact, but every year we've had to increase it by a couple $100,000, which for me, when I have $135 million budget, doesn't feel like a lot, but I know a couple $100,000 when you're looking at general fund departments and a very tight budget, it's not insignificant. And so I guess I just wanted to share that there are impacts that are just beyond what we talked about today that we're having to juggle as well.
Okay, and then yes, sir.
Just to clarify, and I mean, just for people listening,
Yes,
because you mentioned that in statute, right, that the county is responsible for these costs, but that same statute doesn't say the bigger government, the state of California, and then the big brother, the federal government. Also, it doesn't say in statute that those two entities are going to give us the money to meet our obligations. It's just the burden is on us, whether they pay us a revenue stream or not. Is that correct?
I mean, ultimately, the burden ends up falling on us. And so when we do get allocations for programs, IHSS is a perfect example that we do get a state allocation for that. I shouldn't really have to come up with county money to offset that. But if you check with every single county in the state of California, we do not, our allocation from the state is insufficient to cover the demand of our program that has the highest increase of any program. And it's because it's the older population. The baby boomers have shifted in and are needing more service. So we have the obligation to cover it no matter how many dollars they give me. And so then to be able to do that satisfactorily, I have to bring in some realignment to pay the bills, which ultimately then when that runs out is me coming to the county to help cover. So, I mean, I don't even think we're asking for that this year because this HR1 mess is just way more financially impactful. But that used to be our number one priority, is trying to get adequate funding for IHSS. And we've had to put that on the back burner while we attend to this, but that'll be right back on the table as soon as we get some movement, hopefully. And I know that's where you're moving to now, is the legislative advocacy that needs to happen at the state and federal level.
It's a perfect segue to actually introduce Graham on the advocacy level. And then afterwards, we have our state and federal lobbyists online as well that will speak a little.
Mr. Graham Knaus, save us, please.
Good to see you. Okay, so what I'm going to do is there's a proposal that has been created by the entire county family that is public today, and I'm going to talk about that in a second. But I wanted to speak a little cold truth on some of the reality of all this, which is there is no county in the country that will not be severely impacted by HR1. Zero. So there might be individual elements of it that one county or another is exempt for some period of time, but the amount of of costs that are being shifted to counties across the country is a staggering number, and there's a loss of folks who are eligible for programs because they're going to be unable to meet what is a bunch of additional new bureaucracy. And so I just wanted to highlight, like, there were comments earlier about folks that aren't going to meet the work requirements. It's not because they aren't working. They are working. It's because in order to prove that they're working, they have to take time off of a job and no longer be paid to then prove that they are working. And sometimes that is a burden that's too high. And so they forego going through all the bureaucracy in order to get there. That's what the real reality is around this. So I just wanted to highlight that. So what we've been doing over the past number of months is having the whole county family come together and first assess what are the real impacts. What's the reality of HR1 on communities? And what's the reality in HR1 on communities for the eligibility work that you heard about earlier, for the indigent care increases that are there, for the impact on hospitals that is there, for the cost shifts that are happening. And that number is as high as $9.5 billion annually statewide to counties just in California. So that's $9.5 billion a year because of the cost, because of the policy changes and the reduced funding from HR1. So what we've been trying to do is put together a request to the state that is responsible and thoughtful about what's the best pathway to triage the impacts on communities and to try to preserve a healthcare system that works both for those that are on these programs, but also for the broader community. Because when a hospital closes, it doesn't matter if you have insurance. It's closed for you too. And when ERs are overly impacted, that impacts everyone in your community, whether they have insurance or not. And so that's what the core reality is. There's the whole population in Kings and in other counties in the state will be impacted by what is occurring here. And so what we've put together that is going public today, that is on your screen, is a just shy of a $2 billion ask of the state in the current budget and $4.5 billion and ongoing beginning next year. And this is broken down into a few different categories. The first is indigent care, and so you heard about that. And so we're requesting $761 million state general fund to ensure that there's some of that is rebuilding a system that hasn't been in place for 12 years. And some of that is the direct services that would be provided. And I should note that indigent care is not Medi-Cal. Medi-Cal is like full private insurance. It's very similar to that in terms of the level of care that you receive, the prevention that occurs. Indigent care is not that. It's temporary nature. It's more like catastrophic care. It's not preventive. It has a share of cost for folks. It's like subsistence care. So it's enough that you can leave an emergency room in a hospital because you're sufficiently stable, but it is not the care that anyone is seeking to get. And so I reference that because for those that are losing Medi-Cal that may have become accustomed to a certain level of care, like that's not what's coming. What's coming is a far lower level of healthcare for folks. And so you're fortunate as one of the counties that is part of CMSP, as you heard from Carrie Brownstein earlier. And so the indigent care portion helps meet that state mandate that counties must respond to. And I should note that what we're assuming is that of the 1.4 million folks that are estimated to lose Medi-Cal coverage, that 1/3 of them would be covered under indigent care under these numbers. So that 761 million would cover subsistence level care for 440 some odd thousand individuals. For the other 880,000 individuals that would be losing care, we're assuming they get nothing. There's no care. And so we want to be straight up with ourselves, but also with the state in terms of what we're asking them for. And we don't know what happens if the real number that come to indigent care is higher than 1/3 of those that drop off of Medi-Cal. We just don't have any idea. But so there's that $761 million. For public hospitals, there's 500 million in the budget year, and then that's assumed to grow to 850 in the following year. And I should note, there's not a reference to rural hospitals that on this chart or as part of this formal proposal, but it's very relevant in communities. Ultimately, your community doesn't care whether a hospital is public or private. What they care is that it exists and the doors are open. And so we at CSAC are going to continue to work on that issue. But it is also true it is not formally part of this proposal. The eligibility work. This is a combination of the cost shifts that you heard about earlier, and also the increased work. So effectively, it's double the workload for those who are processing eligibility to determine whether someone meets the criteria for food support or for Medi-Cal. And so that's a $373 million number for the budget year. We are proposing also that there is a hold harmless for penalties. And so that was referenced earlier in terms of the state's likely desire to shift those costs if they occur from them to counties. So we are seeking to hold counties harmless for that, because you don't have full control to determine what is occurring in those. And then the final piece, and you heard about behavioral health from your team, is 224 million. And that's a combination of some increase in what the demands might be for county behavioral health and a loss of a revenue source that has been used to fund some of the behavioral health that's already occurring in your county. And so altogether, that's 1.9 billion in the budget year, and then you can see grows into the out year and may grow beyond that. So this is a critical point in terms of our advocacy and where we are with the legislature. We've previously had an education day where we met with 17 combination of legislators. We met with the governor's office. We met with the state HHS secretary and a bunch of other folks so that they're aware of what the impacts are. And we will now circle back with them with this specific request and walk them through it so that they have awareness of it. Our framework for all of this has been the same, which is this is the state's problem to solve, not yours. HR 1 is a federal bill, and so has demands on the state. The state then puts demands on counties. And so we can't change the HR 1 is the federal law, but you shouldn't be subject to the state asking you to do things that it's not going to fund. That's not going to fund on your behalf. And so we've made very clear the state has a structural budget problem related to HR 1 and funding counties, and it must be solved as part of this year's budget. And so that is a different way for our advocacy to proceed. And so we're functioning in a more aggressive manner, in a more proactive manner related to this, because we have to, and it's going to take the entirety of the county family to really make progress on this. And if your team can move to the next slide, there's one more slide here. Okay, and this just lays out what we've done over the past few months in terms of bringing the whole county family together. It is the individual policy affiliates, CMSP, the welfare directors, the behavioral health directors, the public health directors, the public hospitals that have actually built the detail behind the proposal. We simply took that and then crafted a narrative framework around it and created the pretty logos and all the things as part of it. So it looks polished because it is. There's a ton of work that has gone into creating this product. When we move forward to our legislative conference that is in May, then we're going to be asking you and all of your colleagues and our partners and affiliates at our CRC, at the urban counties, and with all the county policy affiliates to really push on the Capitol. But we need to do that now as well. And so reaching out to your legislative delegation is critically important. Reaching out to your congressional delegation so that they understand what the real impacts are and have some potential to delay the implementation of some elements of this in Congress. That's still a possibility, as remote as it may be. And you'll hear about that in a moment. That's where we turn our attention to. And you have a outstanding contract lobbyists both at the state and the federal level. And they're critical assets as part of this. So we're working closely with them as we navigate through this as well. And we're not going to stop until counties have the resources, the authority, and the flexibility to do things in a way that makes sense to you. It makes no sense for you to have mandates that you're unable to fund at the local level. All that means is state priorities and federal priorities don't get accomplished. And so that means they fail. That is not your failure in your community because you can only do that which you're equipped to do. And we're trying to assist and ensure that you have the right tools to proceed. So I'll stop there. Happy to engage in any dialogue that you may wish.
Quick one, Graham. So obviously we're just dealing with California here, but is NACO also pushing something? Obviously their numbers, everything's going to be different. Are they pushing this direction though as well?
100%. They are. And so NACO's been meeting with members of Congress and with the administration. They did so at the recent legislative conference. That work continues. And so they're like seeking whatever kind of waiver exemption delays you can get so that there's a more rational approach to some of this work. So that's happening. That's really hard. It's really hard to undo something in Congress once it's occurred. And so folks are navigating through that. I will note that the state made it worse. And so there was a question earlier about like, is the state getting there? Do they understand this? Well, the budget proposal that came out in January from the governor actually made it worse. And so it took the HR1 impacts from federal policy, passed a bunch of that onto counties, and then it added more on top of it. And so where we sit today is worse than we were before the state got involved in it. And I would note that in a state budget that is $300+ billion, do you want to know how much words were put in there and dollars that were put in there that references the impacts to communities around HR1? Zero. So there was not even an acknowledgement that counties had to do anything, that communities had to do anything around HR1. So that's what we're pushing up against. And fortunately, there's been some level of progress from there. And the legislature has greater awareness around this issue. And I think a willingness to do something, but we're asking for $2 billion. And counties are not typically in the legislature asking for $2 billion. So this is not a normal thing for us to do, but it's something that we will work every hour of every day between now and June 30th to get accomplished.
Are you also soliciting the counties or the regional county groups for letters, things of that nature?
Yep. Letters, calls, visits with folks locally, conversations with the media, talking to your community, all of that is necessary. And so that's relevant for the San Joaquin Valley Association. So we will connect with them. I know Tulare is hosting this year, and so we spent some time with them this morning, and so that's relevant. But it's also relevant for the other statewide associations in RCRC and UCC, and in the paperwork that is attached to this, they're all part of this. So this is a CSAC, UCC, RCRC, CHIA, all the acronyms. Your public's going to go wackadoodle with all the acronyms. But the health executives, the behavioral health directors, the public health directors, those who are running the indigent care program for counties, the public hospitals, and all the statewide associations representing supervisors, we're all a part of this together, which is exactly how it needs to be done in order for us to be successful.
You hear, like EA, sheriff, you know, the other associations that, I mean, quite frankly, are impacted by general fund dollars. Are they coming to the watering hole?
So not yet, but that's a very good suggestion because, and as was evidenced by your discretionary general fund chart, the vast majority of discretionary general fund in every county goes to public safety.
Right.
And so,
Yeah,
and probation. So like, those are the departments that are actually most at risk because you don't get to say no on a mandated cost. And so we'll certainly reach out to them.
Yes, Supervisor Valley. A couple of comments, questions, opinions, but this is exactly why at the local level of government, this is where, you know, the rubber meets the road, where, you know, Graham is saying, asking us to go to our constituents, go talk, help get the word out. But when this comes from the federal government, you have members of Congress from around the country too scared to come home and hold those town halls and have these discussions. But then it falls on us, and we have to go out and start getting some work done here. Sir, one, thank you for being here in Kings County. Appreciate you. This ask, is it in a bill form or is it just some other vehicle to request the money in the budget?
So it's not in bill form because what we're seeking to do is generate the interest and demand in the legislature to include it in the state budget this year. And so this will be discussed as part of the budget hearing process. We're also, the next formal step in the budget process beyond the legislative informational hearings is the governor's May revise. And so where he comes out with a revised set of estimates of revenues and expenditures. And so we're pushing to have as much of this included in there as possible. That's a very tall order. And so we're going to push hard to accomplish that. But we're also not going to be able to get out of this without having strong legislative support to get it done.
Question. It's a huge, because get 10 years ago, for a water bond, that was a huge mission. So to look at this for all 58 counties, I get that part. So, but as you're having the discussions, do you have an early temperature on, is this going to be something supportive on both sides of the aisle, or is this going to get caught up in the mix of, you know, conservative politics or liberal politics? Do you think this is going to be, everyone's going to be on the same page on something like this?
Our strong desire is that this isn't partisan at all. It's like the impacts on community aren't partisan. They happen or they don't happen. That's it. And so we've been educating folks in both houses, in both parties. That work will continue. We've had a positive reception from folks across the political spectrum. And I think there's some level of acknowledgement that counties can't do what the state doesn't provide resources to accomplish. But we don't control how the legislature functions. And so it could very easily turn into one direction or another, which we want to avoid as much as possible. I do think like all of our language is pretty straightforward. there are severe impacts that are happening in communities, and those communities are represented by people who are in the legislature. And so those are their communities as much as they are yours. And so we want to make sure that there's clarity about what those impacts are, and that folks are equipped. And this request will help make that happen. Folks are equipped to have the right understanding of what needs to be accomplished. The state budget is a reflection of priorities, and you cannot tell me that with $300+ billion of general fund, the state cannot fund this. It's just a matter of priorities. Either it's important to do, or communities are left hanging. I don't think there's an alternative.
So then last, so let's say you get this pot of money, and maybe if I missed it in the presentation, but is any part of these monies competitive for counties to apply for? Before there's going to be some kind of data for that breaks down how much each county gets.
So there should not be grants. This should be an allocation. So the money should be distributed. And some of these programs, like the eligibility work, for example, there's an existing structure related to that in terms of how the dollars go out the door. I used to write those formulas back when I was a math geek, and I forgot all that now. But there is a mechanism that is used in order for those dollars to be distributed. It's largely based on where the work is going to be. And so if your caseload is going up by 100, then you get funded a certain amount related to that. And there'll be a similar structure that would be used for some of the other areas that are in the request. But no county should have to apply for grant dollars based upon something that's mandated. Those dollars should flow to you automatically based upon what the need is.
So if the governor puts this in the bill, in the budget, really, at some point though, right, those 80 assembly members and 40 senators, they vote on the bill. Right? So it comes down to each member either being yes or no on this, right? And so when we look at, don't mean to keep going back to the water bond, but that's something that hit us very sour here when we really hard and supported everything they were saying in Sacramento and get on board and let's get this water bond going. Been screaming for, right? What we saw was the politics of, hey, I'll support the water bond. Now I'm so-and-so assembly member out of LA. I'll support the water bond, but here's what I need. And then we started seeing crazy things in the water bond, like somebody asking to maybe even get, and I don't remember it, early earthquake warning system. And we're sitting here going, what the hell does that have to do with our fight for water? So do you see those kinds of politics taking place is to get support for this, that this number might actually grow because Assembly member Senator Joe Blow is going to say, well, I'm only going to be a yes vote on this if I get XYZ funding in this for my district. And that'd be my last question.
So that is always a possibility because the legislature is a unique entity in the way that they navigate through that. So it is something that's possible. I think our biggest challenge is going to get the number as high as possible towards the 1.9 billion there. That is a very hard number to achieve in a year where there is a state budget deficit, and there's more salient for a lot of folks in the legislature is less about the budget they're working on now, but that there's a structural deficit on a going forward basis. And what we're asking for is ongoing money because the demand is ongoing. And so it's going to be very difficult to get near that 1.9 billion and to be positioned for the 4.5 next year. And in an ideal world, what happens this year actually takes care of both this year and next. That's just a very difficult thing to do in an election year when there's going to be a bunch of turnover that is happening in the legislature, but we're certainly going to try. You got it.
Supervisor there?
Yeah, well, first, thank you for your leadership, Graham. I'm new to this seat, been on her for a year, but I've been in county government for about 35 years, and I just appreciate your forward thinking. And I think you said it in San Jose that like CSAC's approach to things is like we're going to be the leader moving forward versus waiting at the end of the at the bottom of the box waiting for things to fall on us, and then we'll be reactionary to things. And so I really appreciate that. But I'm just going to call this out because you see it. You see it in liberal media, you see it in conservative media, that if there's one, there's 10 of these independent journalists who are going throughout these different states. California is the latest target of fraud and abuse. It started with Doge back in DC when the president was, after his inauguration. But with that is, you only know you don't know what you don't know. So is CSAC doing anything in that kind of curvature to go? The latest one is the hospice care down in LA County. And I don't know how the process works down there, but is anyone like putting their fingers on the pulse going, yeah, that is fraud, or no, it's not really directed that way, and there's some other eyes on it? Because on one side of the coin, I understand where the constituency across America is like kind of put back on their heels going, is this really occurring, or is it just, a smoke show? So I'm just curious if CSAC is calling that kind of out of the bag too, just to see what it is. Because I even look in our own, I love our employees here and our department heads, but we can't help but go like, do we really have this number of rural hospitals? Is it really being funded into it? And is it really supporting it? You just, people just want to know, and to make sure that I would suggest that people want to know and make sure of that. And so I just call the cat out of the box on it.
Thank you, Supervisor Thayer, for the question. There is very little actual fraud that exists in programs in California. I'm not saying that it doesn't exist, but it's minuscule in its amount. And the reason for that is because it is so difficult to go through the process of eligibility in programs. It's very difficult. And so and we support, as do you, as much accountability as we can get to ensure that there's integrity in the programs that we operate on behalf of the state. There are a lot of safeguards that are put in place in California. This is true in a number of other states too. But it is a rare day where there's any real fraud that is identified. But there are always opportunities to do business better. And so, do we have the most efficient system in the state of California? No, because it is incredibly complex. In the Medi-Cal program alone, there's like 200 different ways that you have to navigate through the complex matrix to determine whether someone is eligible or not eligible. It's mind-boggling how difficult it is to navigate through that and emerge as eligible at the end of the day. It's very difficult. So we can do business better. We can make things simpler. And I would hope for that to happen. It's hard to do it in a system that is built off of one law change after another law change after another law change, instead of a system where we sit down and say, how would we do this if we started from scratch? And we focused on what we're trying to accomplish, having the right accountability safeguards in place, but having it not be so nightmarish complex in its structure that it's hard for anyone to understand what it is. Because when the public doesn't understand how it works, it leads to questions. And so I think that drives more of it than anything else. It's hard for those who are in the system trying to make it work and ensure that no one receives any benefit that they are not eligible for, and no provider receives a dollar that they are not eligible for. And so we want to ensure that there's a system with the greatest amount of integrity possible. And we've come a long way as a state in ensuring that. It's not perfect, but it's better than most. And unfortunately, like many things that have been built over many decades, it's less efficient than it should be. And that's real.
Supervisor Rupo.
Graham, thank you for coming into Kings County. You've heard a lot from me over the years about not getting any respect from the state association, but I appreciate you coming down here. This is very complex. I think the HSA and behavioral health, they bring in about $1 billion to our economy here, but it's all taxpayer dollars, so it's just money that we've received and redistributed. We also bring about 2.5 billion in ag, which is under attack at this point. And we talked about today about economic pressure about filling out your application. So I'm going through a process right now to fill out money. There's $1 billion available to single farmers around the United States, $1 billion for farmers. So I go to my office, and just like you guys have your office, they just look at me. I have to know every single thing about what I'm doing, what I'm applying for, and how to read it off the internet. So I understand how to apply for it. There's no one there to help me. We talked about hiring more help to help me. There's a responsibility as a human. If you're asking for money, you should know how to fill out your own paperwork. You should understand that. It shouldn't be on our pressure to go out there and handhold someone to give them money. They should have some responsibility, just like I have to have my own responsibility too. We're also, this is typical business where you don't make enough money to run your own business. We're not making enough tax revenue to cover our costs right now. We've had too much waste, too much fraud over the years, too much misuse. It's just easier to give the money out than it is to get it back in. So now everybody that out there has a business is under attack with over-regulation. Money's going out constantly. I spend at least 15 hours a week on a computer trying to get all these committees I belong to for my nitrogen management, water management, all that stuff that I have to maintain, and there's no time to do the work. So I'm working on the weekend to cover my costs because they've raised salary increases to my employees. They can't work a full 60-hour week because an 8-hour day is what a day is, and then 9 hours is overtime. So now it's reduced my employees' time that where they can't make enough money. They're going to qualify for this. So there's an overburden on that. It takes my business. I can't get the work done. I have to do it myself and not pay myself. So this is typical of the government that didn't support businesses over the years and gave too much money away. And now we have no one to pay taxes to cover our costs. So I appreciate what you're doing. I don't have anything against our programs. It's just that I don't know how we're going to get out of it if we're declining so fast. I was on a NACO on the Ag Committee yesterday, and part of it, 30-minute conversation was on behavioral health and suicide against farmers that are losing their farms. That's a serious problem, and those people are going to be on here needing a system as well. But 10 years ago, they were providing the income for these programs. So we need to do a whole shift in our way we do business in California, where we protect businesses so we can fund our programs. I've been saying it for years. Everybody has their hands out. I think we got another meeting. We have people got their hands out. We're moving money. They want to have the access to some of our money. This is a tough time to be an elected official because we have to pick and choose. And I don't really want to be here during that time, but we have to. And I don't want to be a recipient of these programs. I want to be the guy that pays the taxes. So thank you for coming out and explaining to us. I know we were in DC last month. We were on different pages. We were hearing and we were saying it was not the same story. So we need to come together with our local leaders, our senators, our assemblymen, and our senators and our congressmen back in DC. So we both all on the same page, but it's just not enough money to fund the programs. And so we may have to tighten our belt a little tighter and make sure that the people that need the money get it. And the ones that don't so much need it, go to work.
We should have one big, beautiful town hall. Our congressman, our senator, our assembly member, our county supervisor.
You would never get nothing said because one person would take it over.
Thank you for your comments.
All right. Do we have any other questions for Graham? Yes, sir. Supervisor Bell.
Not for Grant. I was going to flip it back over to our CAO.
Okay, well, let's finish up with Graham. Anybody else with Graham?
The only observation, I think maybe the federal side, because I know as with the military installations, a lot of those folks qualify for a lot of programs. And so I wonder if the 4 counties in the state of California that host military installations shouldn't be carved out a little differently. Because I think as though that population, an individual is deployed to Lemoore Naval Air Station, they marry somebody locally, those are not dependent military dependents until they go through the whole process of taking on that load. But that is a load that goes through human services. And so I think, and again, I don't want to carve the turkey up into too many pieces, but there are 4 counties that have large military installations that probably should be held a little bit different. They've also downsized their military population doing the work out there, and they've outsourced it. So you have private enterprises going on there. Those individuals are not making the money that the federal employee that was previously employed doing that maintenance, building maintenance, housing maintenance, parks and grounds. On those military installations, it's outsourced now, and those individuals make less money, less coverage, and they also impact our programs. So I think, and even though I think you're only talking 4 counties, I think that population base should be maybe carved out a little different.
It's a really marvelous proposal for a Kings County member of Congress.
Correct. All 3 of them now.
Right, right.
Yeah,
Right.
With the last unsanctioned reallocation. Thank you.
Okay, thank you, sir. Last chance. Anybody on the board have a question or comment for Graham? The audience? Going, gone. Graham, I can't thank you enough for coming to Kings County. You told me you were going to be proactive, and I see this as a great first step. And Paul, thank you so much for the education. We certainly need it out here. Safe travels.
Thank you very much. Appreciate it.
Mr. Chairman, we still had 2 other guests, additional guests. The presentation wasn't over. If you'd still like to hear from our,
come on up.
They're actually virtual. We have Paul Yoder and Rachel from Paragon. We're going to just some closing points. Paul, we were texting right now, actually. He said, Paul, are you there?
I am. You hear me?
Paul, sorry I cut you off.
Hey, that's the chair's prerogative.
My prerogative is for you to speak. Go ahead, sir.
Well, good morning, board members. Thanks for having me on. I'm going to keep this brief. I just appreciate the partnership with CSAC and everything they're doing. Our firm does represent CMSP, and so and that predates our representation of Kings County. And I just want to make sure that board members understand that that reserve that CMSP has, I've actually lost track of how many times different interests in Sacramento have tried to rip that off. And so our firm has worked very, very, very hard to keep it in place, and we're proud of the work that we've done there. And it turns out it'll benefit Kings County along with all the other members of CMSP. So we're very happy about that. But we're going to be working side by side with CSAC to try to make as much of this happen. I appreciated Graham's comments about the legislature and the governor needing to prioritize in the context of a $300 billion plus state budget. It can be done. It should be done. And we're just going to work every day for you to make sure that you're as kept whole as possible and that residents are getting the services that they need going forward. So I'm happy to take any questions. I know it's getting close to lunchtime. I want to leave a little bit of time for Rachel as well.
Questions for Paul? Audience? Okay, Paul, thank you so much.
Yep.
We'll talk to you soon. We appreciate your efforts.
Yep. Thank you, supervisors.
Rachel, you out there?
I am. Can you all hear me okay?
Yep, loud and clear.
All right, wonderful. Well, good morning. I think Graham, Wendy, her team really hit it out of the park, kind of covering what's at stake here. Just a couple things I will comment on from the federal landscape. And I think Graham alluded to this well, that while there are efforts, and we have certainly been in conversations with your delegation to try and mitigate and reverse some of these cuts, it is really hard to put the toothpaste back in the tube. That said, there have been some pushes, particularly on the SNAP or CalFresh side of things. There was a pretty big bipartisan effort that included a lot of national associations, including the National Governors Association, NACO, some others, as well as, individual leaders from different red and blue states to try and delay some of these cost shifts that are statutory, that are coming down the pipe, particularly for counties, recognizing that it's very unlikely we will see this law reversed in its entirety. There was at least a push to say, hey, give us a few more years, because improving integrity in the program, improving our error rates, which are what are going to be tied to this big benefit cost shift, takes time, it takes investment, and you're asking us to get our error rates down within the SNAP application and certification process at the same time that you're giving us less administrative dollars to do the program. And so there was a push to try and get the benefit and administrative cost shift delayed till fiscal year 2030. It was, not really a very likely outcome. It was sought to be added to the recent government funding package. It did not make it in. But I will say that I think you'll probably see as conversations continue around either a farm bill or a supplemental package for agricultural relief that Democrats in Congress in particular are going to be pushing very hard for some sort of relief on the food assistance side of things. And they will probably hold up legislation that targets agricultural interests unless there is some movement on the cost shifts within the SNAP program. On the Medicaid side of things, we really have not seen a whole lot of legislation yet federally, largely because some of those changes are just a little bit further down the road. But something that we've been trying to make clear, including with Representative Valdeo, is that it's going to cost a lot of money to set up these systems in Medicaid. Medicaid has never had a work requirement. That is not something that has ever existed. So you're asking eligibility staff to really create a whole new system in a very short amount of time. And the law provided very, very little funding to support that work. And it takes a lot of technology and vendors. I think Wendy really encapsulated it well. The systems are not aligned with how they exempt people and include people. So we did work a little bit with Representative Valdeo's office to see if there's a way in the upcoming appropriations package, which really won't be in play until the fall, to get some language in there, maybe asking for a set aside for some additional investment in these administrative structures, maybe even just asking HHS to do a report and really assess the cost to states and local governments to create this new system from scratch so that we can really go to Congress then and say, this is the amount of money we need because the work you're giving us is an unfunded mandate. So we are in conversation with his staff, at least on something along those lines. Again, I think it's a very tough political environment for reversing these cuts because it'll cost a lot of money. That said, you never know. There may be a second attempt in Congress to pass a reconciliation package that targets funding for what's happening in Iran. There's a farm bill. There are different vehicles that we could see used for negotiations of this nature, but because it's going to cost money to reverse any of the changes made under HR 1, it is a uphill battle to be sure. So, we really appreciate the information we've gotten from you all on the ground, continuing to communicate the effects to your member of Congress to ensure that, they're really aware of what this looks like on the ground and how much money we're talking about is really important so that they can maybe provide some help down the line. But yeah, happy to answer any questions and sort of what's happening on the federal landscape here, how we're trying to work with your department heads to finesse this.
Any questions, comments for Rachel? Any from the audience?
I do have a speaker card, Mr. Martinez, if you'd like to come up.
Thank you, Mr. Martinez. Good morning, still by 4 minutes.
I will make it brief. Mr. Chairman, honorable supervisors, esteemed staff, thank you for giving me this opportunity. I just wanted to start by just making a poll of the audience. How many people here receive SNAP or on Medi-Cal? Yeah, just as I thought, nobody. I'm here to not espouse any woke ideology, any progressive agenda, but to speak on behalf of the voiceless, the people who aren't here today, the people who will be affected by what the impact of HR 1 would be. I see the cuts with HR 1 resulting in an increase in the unhoused population and also overwhelming our already overwhelmed ER at the local Adventist Health. Excuse me. I don't know if any of you have ever been to the ER. I have. My wife has been sick the last few years. It's horrendous. and it would just make it would just get much worse. Honorable members, please use your influence with state and federal representatives to expand the parameters of the exemptions or the hardship waiver status and increase, not decrease administration. I think that there's very little that could probably be done given the budget restraints at the state level, the federal trying to reduce expenditures. But if
We're almost
the
out of time, sir. Go ahead.
Oh, I'm sorry, but if the hardship waiver could be amended, that would be great. Anyway, the intention is to root out fraud. Everyone is for that. That's why administrative costs, if that could be avoided, would
Thank you, sir.
be best. Thank you.
All right.
I appreciate it.
Anybody else?
Mr. Chair, I just think it's just worth noting too, that
Yes,
just at least, just to put it on the record in case it's not on the record, that there's at least 3 of us that were in Washington DC. We were in 3 different of our congressional members and with 2 California senators saying this exact same thing. So the message is delivered. I know Carrie and other staff were with us in Washington DC marching the Capitol and expressed these to that. I just wanted to put on public record that message has been delivered. And then obviously in May we'll be in Sacramento and meeting with our other.
Yeah, and there was a difference of opinion between each one of them because no one really fully understands the grasp of it all.
Correct.
You're saying they don't understand the impacts to counties?
Well, they understand impact. It's just each one has a different version of it. Each one sees it a different way. And so no one knows how to get out of it. And so they're all here to help. And so it's once we get closer to the bottom, I think we'll pick the direction to go. But yeah, it's hard to explain it how we're impacted because they were seeing it different ways. So you only have a few minutes, so you need to be on point, and it was really hard.
Yeah, and just to follow up with that, I mean, there was talk about, the exemptions, and it's like, yeah, that's only for, you get like 1 free pass, and then you're going to get hit by the avalanche. So it's a lot of it is just an educational piece, but nevertheless, I just wanted to put it on the record that message has been delivered, sir. We're all barking up the same tree.
I want to thank the staff for putting it together because I didn't have a grasp of it either. So I know it's serious, but how to approach it is hard.
No, Mr. Chair, that to segue into that, I guess to our CEO, if this package of money doesn't pass or it gets cut down, what is our plan B? Because when you start talking about impacts to the general fund, right? As much as we would probably have avoided the conversation, even prior to this, right? Where our budget is going in the future. You probably don't want to hear this, Mr. Chairman. You might want to take a walk, but it sucks to even say it because again, this is all rolling downhill from the feds to the counties. But the discussion or some kind of presentation in their future to the board on sales tax measure to get this budget ready for any impacts that it might have stemming from this. But not only that, the reality of where we are anyways prior to that. But I know it's late. I don't expect to go deep in the weeds, but plan B, right? We got to be ready.
Madam CEO?
Yeah, this is just one of many issues. The county is already facing, our own issues. We have our salary and benefits that make up about 53% of our entire budget. There's things coming up to the board. Like I said, we're going to have to do some hard decisions here moving forward on how we move forward and how we deal with the county finances. And, if your board has a consensus to do so, we can bring back some additional items to present to your board on some strategies. If your board would give me that consensus. We're already trying to strategize, but, obviously, given supervisors' comments, it could be additional strategies.
Okay, last call. Anybody? Go to the order. Anybody out there? Okay, Madam Counsel, you want to explain that the remaining items on closed session are going to be tabled?
Yes, so items from closed session, items 3 to 5 have been moved to the April 7th agenda. That's Government Code Section 54956.9 Subdivision D1, conference with legal counsel, existing litigation, the name of the case Timothy Abels versus County of Kings, case number 24 CU 0399. Item number 4, Government Code Section 54956.9 Subdivision D1, conference with legal counsel, existing litigation, name of case Salvador Segura versus County of Kings, case number 24 CU 0113. And lastly, Government Code Section 54956.9 Subdivision D1, conference with legal counsel, existing litigation, name of case Stephen Mendez versus Corcoran Branch Library, case number 24 CU 0530. And all of these items have been moved to the April 7th agenda.
Okay, very good.
I got a question, Sean.
Supervisor Valley.
Why are we doing that though? The next two meetings should be quick. Then we can go back and eat lunch and get a brief on those. I know at least one of them I want to update on today. The Mendez case.
Chairman, we could proceed with that if you would like. It would just be at your board's discretion.
I have no problem proceeding with the corporate piece. Anybody else have any issues?
Yeah.
Okay, we will reconvene in closed session and take up those 3 additional items.
Okay, so we're gonna reconvene later. Right now, we are going to temporarily adjourn this meeting, and we're gonna go into California Public Finance Authority meeting. After that, we'll do the California Community Housing Agency meeting. 1 o'clock, we'll be back to the Mid-Kings River Groundwater Sustainability Agency special meeting. Okay? All right. So. Great.